Welcome and thank you for joining us today for this Facebook Live media conference. Today's presenters are John Kanoza, Clinton County Director of Public Health, Dr. Wouter Rietsema, CVPH Vice President for Population Health and Information Services and an infectious disease physician, and Ms. Lola Miller, Manager for Health and Safety and Environment at Novabus and Provost in Plattsburgh. Each will provide an update, a brief update, and then we will do our best to answer your questions. Since we anticipate that duplicate questions on the same topic may be asked, please listen carefully, as the information you are seeking may be answered in the prepared remarks or as part of a response to a combination of questions. At this point, I will invite Mr. John Kanoza to the podium.
Thank you, Karen. Good morning, Clinton County. As you may know from our previous press conferences that we've had here, my name is John Kanoza, and I serve you all as the Director of Public Health in Clinton County for the Clinton County Health Department. As I've been doing right along at these press conferences, I will first provide our number of case numbers for you as of today, May 8th. Currently, we have 76 lab-confirmed positive cases. That number remains the same from yesterday. Of those 76, a good number here, 61 are recovered. Probable cases, we have 41, and of those 41 probable cases, 39 have recovered. Total tests completed to date is 959 Clinton County residents, that is, have been tested. And we're working on 13 active cases where we're completing contact tracing currently. I again want to extend a big thanks to you all, the public, for your significant efforts to socially distance during these tough times, simply because social distancing is the priority effort that is being completed, is serving to keep down COVID infections in Clinton County. As always, I also sincerely thank all of our frontline workers, all of our doctors, nurses, emergency response personnel for their tireless work during this tough emergency. There have been several changes to our communication processes this week. CCHD has aligned our case number reporting with recently issued guidance from the State Health Department. The term suspect case is no longer being used. Cases are now classified as either lab-confirmed positive or probable. Lab-confirmed positive cases will remain in that category. A probable case, however, may, after testing, move to the positive category if the test results are positive, or may be removed from the case count if the test result comes back negative. Media releases will be issued as needed. Case counts will continue to be provided via social media, whether or not there is an official media release of information. In response to a lot of the questions and comments from our public, from our residents, trend charts will be posted weekly on Mondays, and CCHD will begin reporting hospitalization numbers with media releases. This week has been quite busy, as have been the prior weeks, at the Health Department, as we have worked with county and regional partners to plan for reopening of services and businesses through a phased approach. Testing capacity in Clinton County has increased, most recently in the last few weeks, and a plan for meeting the governor's testing guidelines for reopening has been established. Testing locations have been identified, plans have been developed, and we have the manpower to complete this mission. Additional testing supplies will be needed to set the plan in motion, and we are working closely with the state as well as exploring opportunities to source these materials on our own. In addition, the CCHD is working closely with regional partners, including public health directors across our North Country region. Clinton County has the required number of contact tracers currently to meet the governor's criteria, while New York State has begun to also recruit individuals who are interested in being employed as contact tracers. This new workforce will fit in when counties lack the required number of contact tracers needed to complete the appropriate contact tracing for isolation and quarantine as needed into the future. CCHD's primary focus currently is on safety, safety sectors right now. We're trying to ramp up everything we can do for safety to bring that to all of our county partners. Liaisons from the health department are collaborating with county officials, county department heads, and town, city, and village leaders to best outline for the reopening of Clinton County businesses as well as municipal offices and, of course, our own county offices here. Our Director of Environmental Health and Safety and the Safety Officer for our Incident Command System, Principal Sanitarian, assigned to the COVID-19 response, is working directly with the Director of Buildings and Grounds here for Clinton County and the county's Personnel Director to identify and make changes to workspaces that will improve the overall safety for county workers. New plexiglass barriers have already been installed for those locations, like the DMV, the clerk's office, where the public is most commonly goes to complete their business. We're also placing signs at various locations in the county, and also floor markers are being placed so that people know a general guide for distancing themselves from others, 6-foot distance, social distancing. Guidance will be sent to each department head in the county regarding cleaning and disinfection, reconfiguring office furniture to meet distancing requirements, safe behavior practices within the workplace, and other measures to protect worker safety and cease the spread of COVID in the workplace. This same information, the work we're doing now on safety, will be the basis for training that will be provided as early as next week by the Clinton County Health Department to codes officers and municipality leaders in our community, so that businesses and organizations within those communities have a local resource for questions. Of course, CCHD will remain as a resource into the future for this. The Clinton County Office of Emergency Services continues to assess the needs of large and small employers and assist them in securing needed PPE, personal protective equipment, and hand sanitizers before opening. In summary, CCHD's goal and Clinton County's goal is to ensure the safest possible return to work. We will proceed slowly, steadily, assess and evaluate our progress, and watch for signs to ensure that we are not moving too quickly. Thank you very much. And with that being said, I will now turn the floor over to Dr. Rietsema.
Thank you, John. Good morning, everybody. I'm here on behalf of CVPH, and I too want to thank the entire community for everything everybody has done to really flatten the curve quite significantly from our worst case projections. Just an update, we have seen a steady decline in activity around COVID at CVPH. We currently just have a couple of people in the hospital recovering, and really are focused now on the same thing that John Kanoza talked about, is how do we open up safely and ramp our services up safely, gradually, carefully, so that everybody can feel reassured. The first thing I want to say is that during the time when we were really shut way down and really doing nothing but emergencies, one of the things we noticed, which is every hospital in the country noticed, is that emergency room volume was way off, way below normal levels. And there's probably many reasons for that. Perhaps some of the people that normally come to the ER don't really have emergencies, and we're heeding our requests not to come. I think that the reduced activity, we certainly had less car accidents. People are driving around a lot less. But there was a third category that I think everybody's been worried about, and we've seen some of, which is people who have real emergency medical conditions and have been afraid to come to the hospital. And we certainly have seen some people eventually come really with severe illness. So my first message is, if you think you have an emergency condition, we are open for business. We have been open for business. we can take care of you safely in the ER, and we can take care of you safely in the OR, and we can take care of you safely in the hospital, in the ICU, or on the floor. So please be reassured about that, and that has always been true. So, you know, at our reopening, we're trying to figure out things that are going to be a lot different. So we have work teams figuring out on how do we ramp back up activity in our outpatient practices. We have done a whole lot of care by telehealth, and we plan to continue that, but there are patients that have to come in and be seen, and so how do we do that? We have one team focused on that. We have another team focused on how do we start doing elective procedures or semi-elective procedures, the kind of procedures we weren't doing during March and April, but now have received permission from New York State to do. But the workflow around that is far different. We have another team focused on how do we start getting people back in for their diagnostic testing, their mammograms, their MRIs, their CTs. People have been waiting for these studies because they haven't been emergent, but we certainly have wait lists. So we're working out how to do that, and things are gradually opening up. Our mammography unit will be starting next week with normal hours. But what I want to tell people is that it's not going to look like it used to look. So we are going to do everything we can not to really use waiting rooms. So the concept of a waiting room right now is a pretty a concept that doesn't really fit with social distancing unless you have a gigantic waiting room. So we will be working much more on scheduling things and having people arrive. If they're in a vehicle, they would let us know that they're here, and we would call them when we're ready for them to move them in directly into a room or an exam room or a diagnosis room. So it's going to be different for every service. So as the service reaches out to you and says, hey, we're ready for you to schedule your procedure, we will have different workflows. But globally, the goal is not to have people sitting in a waiting room. And so that's going to be very different because we're even endeavoring to do that for things that historically people just walk in for. So we're working on that. At the same time, we understand, and as has been previously reported, our hospital, like any other, is in a very deep financial hole, and we need to figure out how to manage our expense much lower than it used to be. So we're looking at what sort of things can we do with our workforce so that we don't get into a space of having to lay people off. I know that there have been plenty of news reports about hospitals having to reduce their staff, and we are going to do as much as possible not to do that. We hope it won't be needed, but we're not saying we won't have to do that at some point given the magnitude of our financial challenges. One really neat program that we're doing, we've started rolling out with our leadership team, is something called WorkShare, which has existed for a long time, which allows employers to cut hours and pay as a result of people, but then those people file for a WorkShare program. The organization has to get permission to do this, and then the day that they're not getting paid for by the organization, they can get money through the Department of Labor, and there's some extra money from the CARES Act. So it's an innovative way to cut your salary expense without having to cut individual people, and we are doing that with our leadership team, and we will and have started conversations with our partners in our labor unions to see whether that's something that we can do with them as well until we get up to full functioning. And to be honest, we do not expect to get up to full functioning for quite some number of months. This is going to be slow and careful. A lot of activity. It feels like we got a brief rest as the COVID curve started coming down, and now it's all about how do we reopen, and I think everybody's working just as hard on that. So that's all I have. And I will now turn it over to next on the agenda, but I'm sorry I don't know her name. So, okay, so she'll introduce herself.
So, good morning and happy Friday and happy Mother's Day. Just a quick introduction for those who do not know me. My name is Lola Miller and I'm a hometown girl from Moores Forks. Currently, I am the Health, Safety, and Environmental Manager at Novabus Prevo and the Operational and Retail Safety Leader for Volvo Group. This virtual role allows me the opportunity to work with safety professionals throughout the world. My career in safety started at Bombardier in 1998, and I furthered my knowledge and experience working at Georgia-Pacific until 2012 when I took my current position with Novabus Prevo. In 2011, I received my Master's in Public Health from Tulane University of Public Health and Tropical Medicine. I have worked with many companies in our community, including Moldrate, Bombardier, Schluter, and McAdam Cheese, to help improve their safety programs and feel very blessed with the opportunities that have been given to me. My career in safety has been fueled by over 30 years of volunteering as an emergency medical technician. Seeing the outcome of unsafe conditions and at-risk behaviors firsthand and the resulting pain and heartbreak that has continued to drive my passion towards improving our safety both in our workplaces and homes throughout the North Country. 6 weeks ago, I had the honor of being asked by Mr. Eric Day, our Car 1, and Mr. Kelly Donahue, Car 2, of the Office of Emergency Services to join the Clinton County COVID Incident Management Team in the role of Planning Section Deputy. Last week, I was asked to join Clinton County Legislative Chair Mr. Mark Henry's working group, which is aimed to guide our area safely through reopening. In conjunction with this effort, our North Country Chamber of Commerce is assisting, as always, under the leadership of Mr. Gary Douglas, to provide programs that will help our local businesses prepare to reopen as safely as possible. An upcoming training webinar will be held twice on Wednesday next week, May 13th, at 10 and again at 2. The webinar's title is Back to Business, What You Need to Know and Do Before You Reopen. This is a valuable opportunity for all businesses, and I advise you to please take advantage of it. In addition, the webinar will be recorded and available on the Chamber's website for those who are unable to attend the live. For years, the Chamber has provided safety training programs which have continuously improved our North Country's workplaces. Another support organization available to you is the Northern Adirondack Health and Safety Council. This is led by President Casey McLean from Johns Manville, which comprises of multiple companies throughout the Adirondack region to help mentor and assist businesses through our OSHA VPP program. Our community has shown its strength and resilience throughout the years, but especially in times of need and crisis. We have persevered through multiple disasters, including the flood of 1996, the ice storm of 98, 9/11, Irene, and Sandy, to name a few. Volunteering during most of these disasters, I can honestly say that I have never been prouder of my community and our leadership as I am today. I personally would like to thank the members of the Clinton County Health Department, the Office of Emergency Services, our legislative body representatives from city, county to local townships, and our law enforcement agencies throughout the county for their tireless efforts to keep our community safe and well informed. My knowledge and expertise has been significantly morphed by the ability of each member of the above-mentioned departments. Hats off to such a wonderful crew. I would be remiss not to acknowledge the substantial contribution of Forest Ranger Mr. Dave Russell, who for his expertise and knowledge of the incident command system and his strong personal mentorship that he gave me as I worked under his leadership in my ICS role. Together, our community has made multiple sacrifices to prevent the loss of life and curb the spread of this disease. I personally thank you all. Good news is that we are showing signs, as Dr. Rietsema said, that our actions in physical distancing and wearing facial coverings in public has paid off. Now the tough work begins, but we are North Country tough. We absolutely must reopen our economy, but we should not sacrifice one single life to do so. With this in mind, we need to be smart about how we proceed. At Novabus Prevo, we took an employee-centered approach to this pandemic from the beginning. We were granted the essential business classification, but our leadership team at all levels, from our plant manager, Mr. Greg Cody, to our vice presidents, Mr. Vincent Plante, Mr. Martin LaRose, and Mr. Francois Tremblay, and our president, Mr. Ralph Axe, uniformly decided that it would be in the best interest of our employees and our community to not fully reopen. Just recently, we slowly started to recall employees and help complete the production of buses to meet our Prevo and Novabus customers' needs. To help ensure our employees' safety, we created a process to pre-screen and recall employees prior to returning to work, and developed a more intense screening, including taking temperatures before allowing employee entrance to help prevent the spread of this disease. I think it is important to point out to everyone the need to keep in mind that the screening process should not be taken personally. And each one of us needs to be as honest as possible and look at the screening process as a way to help protect not just every employee in the facility, but every employee's families as well. Following the guidelines and recommendations provided by our health authorities and local governments, we have made multiple improvements to help protect our vital human resources, our employees, from this terrible disease throughout our facility. Improvements include adding multiple hand sanitization stations, providing plexiglass barriers, as John mentioned, to help minimize close contacts, hands-free faucets and flushing units, moving to 100% fresh air intake for our air handling systems, blocking common doors open to minimize touch exposure, providing both reusable and disposable face coverings, and ensuring a minimum of 6-foot distancing is provided in our common areas. In addition, we are launching a significant communication program collaboratively with our HR and production, logistics, and engineering departments to ensure all employees, contractors, vendors, visitors, and customers are fully aware of both responsibilities that we, the company, have and their responsibilities to help together beat this invisible enemy. This is just a very small taste of what we plan to do to help protect our Novabus Prevo workplace family. But in words used by our Volvo Group president, Mr. Martin Lumstead, I take my hat off for all that we have accomplished, but I put my hat on for all that we have yet to do. I didn't do that as good as Mr. Martin Lumstead did, but I tried. Nova, Prevo, North Country strong. Let's protect lives. Let's continue with our social, physical distancing. Let's continue with wearing our facial coverings in public and when we can't, stay 6 feet apart. And let's open our economy safely. Thank you.
So we have received some questions, so we will go through some of those now. We did receive a question asking how reliable is antibody testing?
So antibody testing is, of course, a big topic. Everybody wants it. There's a great article in the Washington Post that everybody thinks they had this disease and they want the testing. They even coined the disease, I think I had itis, and it's true. Antibody testing at this point in time, I think, is of very limited utility to most individuals for a couple of reasons. Number one, not all the tests that are out there and available are equally good. Coronavirus exists in many forms, and not all the antibody tests are good at only testing for antibodies to this SARS-CoV-2. So that's first problem. Second problem is that we really don't know that a positive antibody means you're immune. We think it might be true, but we don't know. And until we know, I would be afraid of someone getting an antibody test and thinking, great, now I don't need to take any precautions at all, because we don't know if that's true. Third, in this community, if you thought that, some people talked about early on, hey, we'll test people, and the people that are antibody positive, those are the people we'll bring back to work first. Well, from work that New York State did in the North Country, we know that only about 1% of people have a positive antibody test, so you'd have a pretty empty workplace with that. So at this point, it's of limited utility. I could imagine that if I had to fly somewhere, I might feel a little bit more reassured to actually take an airplane if I had a positive antibody test, but I'd still take every single other precaution that is recommended at this point until we have better science. Getting back to the original, the FDA is actually looking at a lot of these antibody tests because there's concerns that they're not terribly reliable. So.
There is one other second part to that question. You did address it, but just giving you the opportunity if you would like to say anything else about it. If someone tests positive for antibodies, does this change social distancing recommendations for them, and do they still have to stay home?
So in my mind, it doesn't. And until we have the answer to the question is that do antibodies mean that you are immune? There's two things. We don't know the quality of the test that was used, and we don't know, even if it's a high quality test, if that makes you immune. I'm certainly not willing to bet my life, and I'm 61 years old, so I'm in a danger zone. I would not bet my life on an antibody test that I don't know what it means, and I don't even know if it's accurate at this point in time.
We did get a couple of questions asking if the county has received their antibody results from the test that the state had done.
On the results of the tests that were completed just a few weeks ago at a local grocery store, I can report to the public that we have not yet received all of those results. We have had some discussions with some of the people who called in to ask, what do these results mean? But that's about it. We still have not yet received the summary of results for all of those people tested.
There was another question, Mr. Kanoza. What is the difference between the CCHD and the state listing of case numbers?
I can answer that very quickly. We are trying to align ourselves now exactly the way the state is aligning their numbers. We just happen to be a little bit ahead of the ball game with the results of our numbers versus theirs. They will be continuing to be just a little bit behind us in terms of lab confirmed positive cases. So.
Can you address whether or not we can meet the state's required tracking numbers at the reopening goal date of May 15th? Will some furloughed county/city employees be able to put to work in this capacity?
I'll answer that first part of the question. May I ask you to repeat the second part? First part of the question, we are on pace to meet the requirements of the state of New York, Governor Cuomo, to have all of our contact tracers that we need should we see a ramp up. Right now, we're using the majority of those same contact tracers that we had during the heavy lift period a few weeks ago. We were very busy, but we have adequate contact tracers. The second part of that question, or I should say the second part of that answer, is we are currently looking really good, and I tip my hat off to the hospital and to some other local medical provider offices who are doing testing of numbers these days that meet or exceed what is required for Clinton County specifically. We all should know that we are being looked at as a region, so there'll be 11 counties being looked at in the North Country to see that we are attaining those numbers that we need to hit. The second part of that question, Jen?
The second part was, will some furloughed county/city employees be put to work in this capacity?
I don't think I can answer that question. I really don't know. It's in a lot of things these days, it's day by day, week to week. So,
Thank you. There was another question, I believe, for Dr. Rietsema. When will the doctor's offices open for a visitor at the hospital like the cancer center?
So I'm not sure I fully understand that question. The doctor's offices are opening up for patients. At this point, I do not believe that they will be bringing people in with patients unless there is a medical necessity. So I could imagine a medical necessity if someone was not able to speak English and required assistance from a family member, or someone had dementia, there might be medical necessity. But we are still governed by, at the hospital, we are certainly still governed by the New York State directive on visitation. And frankly, the way to keep our people safe and to guarantee safety for our patients is to limit the number of people in offices. So I do not think that there's any immediate plans to bring visitors into doctors' offices, and there certainly is not at the hospital. We will continue to have restrictions for some time, I expect. As Lola said, and as John said, opening up should be a slow process, little by little, with consistent and constant monitoring to make sure that the last thing you didn't cause a blow-up of cases, because I too agree that we should not open up at the cost of lives. I know there are others that disagree, and that is a fundamental question. My opinion is that we don't need to cost lives to open up. We can do this safely with a little time and a lot of work.
Thank you. Another question. Does the CCHD have any specific policy recommendations for actions/steps to take when/if an employee of a newly reopening business is notified to have tested positive? Are there recommended post-testing steps for closure, cleaning, sanitation?
if we encounter, as we have been all along, encountering workers at different facilities that test positive, everything stops. Stop and think. That's the goal here. We identify that person. Hopefully they're home when the test results arrive, or else if they're at work, they're asked to go home quickly and self-quarantine or isolate. We then would work, our contact tracing nurses would work with the owner and employees at that business to contact trace, to try to find out who was in close proximity to who, and so that we can identify if you've got someone washing dishes in the back and the sick worker was a waitress that never went into the back, perhaps, that's a lesser risk. But we would look to quarantine those people, those workers who are in closest proximity to the person testing positive. Ask them to stay at home 14 days. So that would obviously impact that business. In addition, we would work with the business owner to implement full cleaning of his facility, of course working with the local municipal codes enforcement official where that business resides to do that. So it would definitely be a stepped approach to work towards eventually, hopefully within days, getting that facility open again, and hopefully not having it in too many direct contacts where the positive person had a lot of close working relationship with other workers at that place. That could impact the place. So.
The next question, with more testing kits in Clinton County, do we meet the governor's requirements for reopening?
We are seeing that happening right now. As I mentioned, that our ability to do more testing, and I take no credit for this at all. It is, and I bow to the hospital and all of our medical providers. They're getting some test kits too. The hospital and medical providers have ramped up the number of tests they are doing per day. It's quite impressive, and we at this current time will be able to meet that. In addition, Clinton County Health Department is identifying, we have a site location for if we wanted to do daily, or I should say probably weekly testing. We couldn't probably do it every day, but testing at a facility drive-through like a lot of the public has seen on TV in other of the big cities. So we're getting ready for that as a potential supplement to what the hospital and medical providers are doing locally. So we will be good with that as long as we keep getting the test kits.
The second part of the question was, how many test kits do we have roughly?
For the hospital, I can report they have a little over 1,000 test kits on hand right now. That's the latest words, the latest information that I have. But just like with our health department, things change at the hospital quite rapidly. But they've been doing quite well recently, holding that number.
Thank you. Another question was, when will it be considered safe for us to gather with family and friends that do not live under the same roof?
That's a very tough question. On the calendar, the state is currently looking at the 15th, give or take after that. It depends on what that family is doing out in society. We're hoping that it's sooner than later. It could be as early as June. We don't know. We just don't know at this time. The state is looking at us. We're looking at ourselves and looking at the numbers and our limited number of new cases per day. That's a very valuable number. The number of recovered cases that we've had. So we're hoping for sooner better than later, but it's still too difficult to say that right now. So.
A question in regards to, I believe, in businesses, the question was, with plexiglass, will we not have to wear masks?
No, we would prefer always that if you're in public, okay, when you're at home, obviously, you're not necessarily wearing a mask unless you have people visiting your home. But if you're out in public and you are in front of plexiglass, clerk station, something of that nature, you should still be wearing. It's just an additional barrier to prevent others and protect others. That's the correct wording there. So, and we would like to have multiple barriers at all times.
A question, any thoughts on summer camps if they will open?
At this particular point in time, that is moving forward as planned. Children's camps have not been closed regionally. So as I understand, though it's a little bit early in May, children's camps are still on the schedule for opening. As far as activities during the summer, for children, there will be, no doubt, less activities for them that will be available in the public that are offered by, let's say, towns, various municipalities, recreation departments in different towns. But I do know that our local towns are each working on their own set of plans for minimizing some of the activities that will occur this summer. So they're still sticking with it, but it'll definitely be less and smaller capacity groups, if you will, for obvious reasons. That's what they are looking at, as I understand.
Another question in regards to reopening. When will small retail businesses with the ability to have one employee on at a time be allowed to reopen?
Business openings. The governor's phased approach has 4 specific phases. I believe that is in a phase 1 or phase 2, so that could be coming up sooner rather than later. But I don't have a specific date on that. So I would say consult with the New York State website for the governor's different phases, and that can give you a better handle on things. So.
I think our last question for today, any recommendations about how to express to someone that is out in public not wearing a mask?
That's a tough question. Everybody talks and is the way they are in their own way. I would just say, excuse me, I think you're a little close to me there, pal. You know, that's me. Other people are a little more straightforward and maybe abrupt. But I think that people need to definitely respect social distancing these days. We're all different. We all have different mindsets and what we consider as appropriate and courteous in the public. But I don't think it's a bad thing to just say, you need to step back. A few weeks ago, I went to a grocery store and I had my mask that I have right here in my pocket. Totally forgot about it. I walked in the store and I had someone give me the eyeball. And that was a wake-up call because I was like, oh, got to take it out and put it on. It is appropriate in this time to wear a face mask and appropriately social distance yourself. That's just the way it is. To say it nicely, courteously, professionally, all will be well. Yep.
There was one additional question of somebody asking when, and I believe you did say this date earlier, but if you could just repeat it, when the hospital will be opening for elective surgeries, excuse me.
So our target for that is, I believe, Monday, May 18th. So more to come on that. People, we are starting to tee up who those patients will be. And if people have been waiting for cases, they will, if they're going to get scheduled during that time frame, I am sure that their particular offices and surgeons will be communicating with them. But our target is the 18th, which would be not this coming Monday, but the Monday after. It will not be full, we will not be operating the first day at a full capacity. People need to understand that. It'll be slow. Our systems will be new, and we're going to have to learn as we go.
Thank you for joining us today for this media conference, and we hope that we've answered most of your questions. We know that many of you are also following the governor's media conferences daily. A lot of information comes out there, and we listen to those as well to get some of that insight in terms of opening and information that is coming out daily from the governor's office. So we'll answer as many questions as we can, but sometimes those answers may be in his press briefings as well. And I did want to just point out two of the pieces of information that Lola Miller had shared, and that is the North Country Chamber of Commerce as a resource of their website, www.northcountrychamber.com, and also the Northern Adirondack Safety Council, who can be found on Facebook. And thank you.